Does this sound familiar? All women who are post-menopausal need to be taking 1,200 milligrams of calcium every day in order to prevent the onset of osteoporosis. Life would be much easier if it was that simple. However, there is much more to calcium than taking 1,200 milligrams daily. In this session of the Healthy Corner, we want to take a look at calcium and what it takes to get to the bone. Did you know that calcium is the most abundant mineral in the human body? More than 99% of the calcium in your body is stored in your bones and teeth. Calcium is what makes our bones and teeth hard. Unfortunately, that leaves only about 1% available for the blood and soft tissue. This is a critical percentage because calcium concentration is in the blood, and extracellular fluid allows your muscles to contract, blood to clot, and the nervous system to work properly. These functions are so dependent on that 1% of calcium left over in the body. In fact, this amount of calcium is so important to survival that the body will steal calcium from our bones in order to maintain adequate blood and tissue calcium levels. Over time, if your calcium intake isn't adequate on a daily basis, this could lead to weak bones or osteoporosis. We will be going into more depth about osteoporosis in the next segment of the Healthy Corner. Besides healthy bones, here are just a few specific benefits of an adequate amount of calcium in the body. Prevention of colon cancer, hypertension, cardiovascular health, and preeclampsia of pregnancy. Calcium provides the tissue glue for cell adhesion that maintains the integrity of the skin. That helps diminish sunburn on the skin. Check out one of our silver bullets to prevent sunburn. Calcium regulates pH, and a normal pH makes it easier for the cells to absorb nutrients. Adequate amounts of calcium are necessary for proper DNA function, nerve impulse conduction, muscle conduction, and contraction. Are you getting the picture? Calcium is needed for just about every body function. Unfortunately, according to the continuing survey of food intakes of individuals, 1994 to 1996, Americans do not meet the recommended intake of calcium. What makes the issue worse is absorption. Whenever it comes to absorption of calcium, it is important to evaluate the GI function. If hydrochloric acid levels are not adequate, absorption of calcium and other minerals is poor. The next issue for adequate amounts of calcium in the body is the supporting cast. Vitamin D and vitamin K are needed to ensure proper metabolism of calcium to the bone. Those levels can be checked through the Healthy Community at Capture Your Health. Oh, I forgot to mention one more item, the amount of progesterone. It is known that estrogen will slow the process of breaking down old bone cells, and progesterone enhances the growth of new cells. Therefore, it would be in your best interest to have your progesterone level checked. Once again, this can be accomplished through the Healthy Community at Capture Your Health. Who in their right mind wants to be walking around on old bone? As you can see, bone health is not just taking 1,200 milligrams of calcium daily and hope for the best. The proper functioning of the gastrointestinal system, absorption of vitamin D and K, adequate amounts of protein intake, and good progesterone levels will help to ensure correct calcium levels in the body. If any of these ingredients are missing or on the low end of the scale, the calcium you are taking will go to the blood and soft tissue not the bone. If you have any questions that concern you, please feel free to contact us at captureyh@gmail.com or drop us a note on the website www.captureyourhealth.com. Thank you for joining us at the Healthy Corner. This is Dr. Bud. Be healthy and make it a great day.